Thank you, Mr. Chairman and Ranking Member, for having this hearing. Is this working? I appreciate the witness's testimony. It's very helpful to hear directly from individuals who are affected or are trying to help others who are affected by the law. My wife and I ran a small business in our community for 22 years, so we know a little bit what it takes to meet a payroll, keep the doors open, keep customers coming back, and deal with regulations and taxation issues. So we're very sympathetic to small businesses on a number of levels. And we also know that the businesses have to stay profitable and they have to find a way to grow. So all of these issues are very important to me. That's why I wanted to be a member of this committee, so I could see, along with my colleagues, what we could do to help small businesses be more successful. And since I've come here last year in June, I've been trying to partner with people on both sides of the aisle to find reasonable fixes for the Affordable Care Act. I think there are many benefits. We've realized many of them already, individuals and so on. And now we're into the larger implementation with small businesses and individuals. The benefits are real, but the issues are real as well. And I think with any major piece of legislation, over the decades, we've always had to make amendments and revisions to a bill of that size and magnitude. So I'm clearly interested in learning more about that from you. I mean, clearly, as I look at this, and I've heard your testimony, and when I listen to people back home, small business owners, I'm reminded that there are 3 C's that they often talk about. They talk about the ACA's complexity, that it's confusing, and that it's challenging. And my job as a member of Congress, and I believe that all of our jobs, is to get through all of that and help people be successful and understand the law. So I have the same question for each of the witnesses. If you could make one change, or if you could ask one question to be resolved by the agencies that are responsible for the Affordable Care Act, what would your top priority be? Because I think we need to have some instruction or some ideas from witnesses about what we can do. My colleague, Ms. Hahn, was asking about, let's figure out what to do that makes things better. We're not just talking about back and forth arguing. Let's talk about what we can do to fix things. What would those things be from each of you, if you could?
I'll go first. I would position the aggregation rule to fulfill the scope that it was originally designed to fulfill.
I take the same approach. We're looking at the insurance product. I think the real issue with health care in this country is that the quality of care is not what it needs to be, and the ACA didn't really focus on quality except in a very small segment with some research, so there's a lot more that needs to be done there. And again, I think that the required insurance, the types of insurance, it doesn't make it very easy for people to comply with the rules.
All right, thank you for your testimony and your good answers, and I yield back.